once again, listeners. This is Mark Griffin, Director of Customer Solutions here at Construx. We are a team of engineering experts led by legendary author Steve McConnell. Here we believe every software team can be more successful at delivering higher levels of business value. In each episode, we talk with one of our consultants, exploring one of our different types of engagements. We would describe the issues those engagements were designed to address and how we solve them. And today we're going to venture off the path, as we do occasionally, with a fascinating discussion with Steve McConnell concerning the topic of estimation. For those that might not be aware, Steve has developed a model for a very timely problem, and that is the Covid-19 forecasting. He's put his considerable expertise and client experiences to bear on this problem that everyone clearly is interested in, and today he ties his work back to software estimation. So we're going to explore what Steve has learned from his modeling efforts and the lessons learned from that are valuable for the software world. Welcome back, Steve.
Thanks for having me.
I'm glad you're here. So as a way to understand what a non-epidemiologist is doing in this forecasting petri dish, how about you tell us what it was that got you involved in this effort in the first place? And really, aren't there plenty of software estimation fires to fight? You step into this one?
Well, I think, what got me started originally was I was reading these news reports, and I guess basically just got tired of having every single bit of data ever reported having spin on it before I saw it. And so I started really just by looking at the data and trying to get an understanding, like everybody else, of what was really going on with the pandemic. And essentially one thing led to another. After I looked at it for a while, then I started paying attention to the forecasts, and it just didn't match my gut feel of what I was seeing in the data. So I started forecasting myself just really informally, almost as a hobby. And then I just kind of got more into it. And, I like to see whether what I'm doing is any good or not. So I started looking at whether my forecasts were very accurate. And then I started comparing them to the forecasts that were being published in the news. And I was kind of surprised to see that my forecasts were doing as well or better than most of what was being reported. So I really just got into it kind of one step at a time. And before I knew it, I was just kind of up to my eyeballs in it.
It's kind of like anything else. I think you investigate things and start really realizing that maybe there's some things you can do to help. So one of the things I guess I think about before we get rolling into the weeds here is that we should really kind of make a comment ahead of time that we are talking about a subject that is emotional, right? The forecasting we're talking about is forecasting loss of life, right?
Yeah, it certainly is. And I think different people are going to have different reactions to that. For some people, I think that it's they just have an impossible time looking at the numbers without seeing a human face behind each one of those numbers. For me, I think the psychology was just a little bit different. For me, it actually was a way for me to feel a sense of control during an uncontrollable situation. And also, I think, an ability to contribute. I think this has been the biggest issue that we've had as a society in multiple generations. And I really think it's been important for each of us to try to contribute wherever we have the ability to contribute. I happen to have a pretty solid background in estimation, and so that was a place I saw that I could contribute.
Yeah, and I think what you've done here is fantastic, and we'll talk a little bit about some of the results you've been achieving with your model as we get into this conversation. So to be more detailed here about what we're talking about, your model that you built has been accepted into the U.S. Center for Disease Control's Ensemble model. So that's a pretty big deal, right? Tell us about the different organizations that are involved, the pedigree with some of these people that are working in the forecasting effort. And you said something about there being 27 different participants?
The exact number that have been participating has changed over time. And last summer of 2020, there were maybe under 20 teams contributing death forecasting models. And now, speaking in February of 2021, it fluctuates week to week, but there are 30 to 40 teams contributing. The pedigree of some of these organizations is quite amazing. We've got teams from Harvard and Carnegie Mellon and RPI, Georgia Tech, and USC, UCLA, University of Massachusetts, and Amherst. Some pretty amazing teams, really. MIT. We've got corporate teams that include members from Google and Microsoft and other really high-profile companies. And this was actually one of the reasons why I was a little bit slow to get involved. I just kind of assumed that with this caliber of institutions contributing, and with me not knowing anything about epidemiology other than what all of us have learned over the last year, I didn't, initially didn't really think there would be any reason for me to try to contribute. But once I started looking at it, I was pretty shocked at how, well, to be blunt, how bad some of the forecasts were that these teams from really respectable institutions were contributing. And so it did look like there was an opportunity to contribute in a positive way. So really, the criteria for being included in the Ensemble model is that you have to provide forecasts on a weekly basis. There's a lot of specific requirements for the nature of the forecast that you provide. You end up producing about 10,000 data points per week to submit a forecast set into the Ensemble model every week. So that's what I've been doing for the past several months.
So that's your Netflix and chill kind of thing?
Yes, my family has joked about that quite a bit, and it's basically, dad's in the office working on coronavirus, and so everybody's got to have a hobby, and that's been mine for quite a while now. Go.
So, I mean, I think we all have become much more aware of epidemiology and different things associated with this virus over time, just by necessity of wanting to figure out where, I think we're all interested. Where are we, right? That's the kind of big question that people get asking all the time. And that's the media attention, that's the modeling attention, all those kind of things. Mm-hmm. So when we talk about, let's tie some of this back to software estimation. One of the things that we always talk about, one of our probably primary guidance things that we use with clients, is to say that you really need to use historical data. And we're going to talk about that in more detail as this podcast unwinds. But I think it's fair to say that most engineers and managers in the software environment have a limited data set that they work with. They don't have thousands of projects that they can cull to analyze. Some of them do maybe, but most of them don't. In the case of COVID-19, my guess is you were probably pretty excited to be working with such large amounts of data. Give us a feel for the size of data sets that were different modeling teams using in this particular environment.
Yeah, I mean, you're absolutely right that in software, part of the challenge is actually collecting the data. If I had to go collect the COVID data, there's no way I would have ever gotten started on this activity. But, given the situation we've been in, there are lots of organizations collecting the data. So, that's readily available. And as you suggested, there's actually a large amount of data available. And the different modeling teams are taking quite different approaches to what data they're using. Some of the modeling teams that have gotten the most publicity are using data like based on cell phone records and mobility that they can infer from where the cell phones are moving to. We've talked about sampling sewage, among other things, and collecting data.
Well, at least you didn't have to do that.
Right.
Definitely would have taken you off the list.
Yeah, everyone needs to pitch in where they can, but that's an area where I wasn't that interested in pitching in. There's a team from Carnegie Mellon that says they have over 500 million records in their database that they're using to support their modeling. So there's a huge amount of data available. My approach is fairly simple and really just makes use of positive tests, total tests, and deaths. And that's all sliced and diced in different ways. And also dates. Dates matter a lot on this topic. But compared to what some of the teams are doing, my approach is pretty simple, and I'm actually not using an enormous amount of data. It would be more than you typically see in a software project, but it's pretty tiny compared to what the universe of other teams are doing with COVID.
Well, that is a data-rich environment indeed. I mean, I think about this and I say to myself, that all these people with all this data, there must be some really accurate forecasts being supplied, but that's not what you really found when you started looking at it, is it?
Yeah, it's interesting that as I said a minute ago, with the institutions that are represented here, you'd expect the forecasts to be quite accurate. But when I started looking at how accurate they are, I found something that I actually have seen in software many times, which is that just because someone is good at something doesn't mean that they're good at estimation or forecasting. And in software, in my estimation book, I talk about the fact that most estimates or forecasts tend to be created by subject matter experts, not by forecasting experts. And subject matter experts tend to use simple, or I would even say primitive, forecasting methods that often don't work very well. And so we've seen a lot of sensationalism around publicizing some of the so-called forecasts that have just been completely wrong. Just they've missed by huge factors, and I think that's unfortunate. Of course, the boring forecasts that are just regularly, repeatably, pretty close to the mark don't tend to be as sensational. And I mean, I have to say, I'm baffled. The situation we're in is already incredibly sensational. It's a once in a lifetime societal challenge. I haven't seen any need to exaggerate that, but apparently some of the groups out there have. So we've got more than enough sensationalism in the facts without needing to go beyond those.
Well, I'm hearing about some crazy new viruses in Indonesia. I hope this is a once-in-a-lifetime event. I hope this doesn't become a normal event over time.
With crazy you and everybody else on the planet.
Really. So how is your model faring at this point? What has been the results so far?
My model has fared quite well. It has, in any given week, one of the interesting things about the COVID forecasting has been that no model has been the best model on any kind of long-term consistent basis. You'll see a model that does way better than everybody else for a couple of weeks, and then it'll fall back. And then you'll see a different model come out and do better for a couple of weeks. And really the Ensemble model, which is the model of record for the CDC, is the one that has been the most consistent over time. And the way the Ensemble model is constructed is they literally take the average of all of the forecasts that qualify that are submitted. So my forecasts are contributing to the average forecast that is presented in the Ensemble model. And this sort of model of models, or there's a reason it's called the Ensemble model. It's an ensemble of other models, has been pretty reliable. And so when I look at it, my forecasts have certainly had plenty of turns where they've been the most accurate forecast of the week or for a couple of weeks. In general, my forecasts have been in the top quarter. And what that means is I think I'm contributing in a positive way to the Ensemble model. And as long as I keep doing that, then I'll keep contributing. If I started seeing that I was in the bottom quarter, then that would make me feel like I was dragging down the Ensemble model, and that would be time to exit.
Right. So the CDC thinks what you're doing is good. It's useful if they include your model in that practice, right?
I think that the group that's running this is a really good collaborative group, and I think they have really been a model of collaboration, really. And so, yeah, I think that I've gotten positive comments on my contributions, as have the other groups that are contributing. And because there are so many different approaches taken to the forecast, there really is a wisdom of crowds aspect to this, where
Sure.
Even if you have models that aren't that good most of the time, they have their moment in the sun too. And so every once in a while there will be something that you can, that's one of the models sees that nobody else is seeing. And so I think all of them have ended up contributing positively to the Ensemble.
So share some dirt. Have any of these models got thrown out because they were so consistently bad that nobody wanted them?
Well, the dirt that I would share is when you get into the CDC forecasting group, you participate in a weekly call. And I think one of the things that I was really surprised by was how academic some of the discussions are. And I mean, I was quite shocked. To hear these discussions, you would think that everybody was engaged in an academic exercise to get ready for the next global pandemic that shuts down the whole world for a year. And it's like, sometimes I feel like reaching across the internet and shaking these guys and saying, hey, this is the pandemic right now. This is the problem that we need to focus on. But you do get some of the universities in particular that are quite academic. And I think I was quite shocked to find didn't even really pay attention to whether their forecasts were accurate or not. And for me, it's just such second nature to want to know whether what I'm doing is any good or not. Of course, I'm going to be evaluating my forecasts, but I was shocked. I think probably at least half the groups were not actually evaluating their forecasts in any kind of systematic way. So that's the main dirt I could contribute. And then to add a little bit to that, as time has gone by and as I saw that as an issue, I saw that my opportunity to contribute could actually be more in the form of encouraging the groups to evaluate their forecasts. And so I've spent a lot more time on evaluation and making those evaluations available. And I'm really happy to say that 7 or 8 groups have actually established regular dialogue with me about their forecasts. And I do think that we've seen the forecast get better. And so, these are super knowledgeable and sharp people. And I think it was just a blind spot. And once somebody made it easy for them to evaluate their forecasts, then they did in fact start doing it. We started to see some of the models that had not been performing very well are actually performing much better.
Well, as we were talking here, one of the things I thought about in your guidance in your software estimation book, you recommend to teams not use a single model every time they're looking at things, to more look at things like, for example, expert judgment or t-shirt sizing or different things. And in that respect, I guess it's like an ensemble model, right? You're taking different models together and seeing what the overall looks like, or you're maybe averaging a series, and see the ensemble sort of does that. Is that a reasonable extrapolation?
Well, so in the software context, the way I would attack this issue is through the cone of uncertainty. And if you're in the wide part of the cone where you're facing a lot of uncertainty, then it's unlikely that you're going to get a high percentage of the truth from any individual approach. And so in the wide part of the cone, meaning early days of a release or a project, it makes sense to use multiple approaches just because you can't put that much stock in any individual approach. Later, as you get deeper into a release, as you've got if you have intact teams or they've gotten up to speed and they know what their velocity is, there's definitely a point where the value of multiple approaches diminishes and in fact probably diminishes to zero.
Right.
But with COVID, I think the whole thing has been effectively in the wide part of the cone. So
unfortunately.
Yeah, so I mean, it's interesting to compare that to say forecasting for flu season, where that's a more mature area. We're really not in the wide part of the cone for flu forecasting, and so you could use more definitive individual models for that. But we're literally having novel coronavirus, something new that nobody's seen before. With that kind of uncertainty in play, I think the ensemble approach has been very appropriate.
I've been here at Construx for 14 years. You've been talking about this for a long time. Maybe what I should do is we can just recurse just a little bit on baseline understanding here. You like to phrase these things as estimates, forecasts, and speculation, particularly in the case of some of the things you've seen with COVID. So let's talk about that progression of understanding and how that played out with your COVID stuff.
Yeah, so I think in media reports, everything gets called a forecast with regard to the pandemic. But I would draw a pretty sharp line between what I think is a legitimate forecast, which is based on data and calculations, and speculation, which is really just more of a scenario idea where we're just saying, well, this might happen. And what we've seen is that on a forecast horizon up to about 4 weeks, we can make meaningful forecasts that can be pretty accurate. Once we get beyond 4 weeks, the accuracy degrades pretty quickly. And we've got some modeling groups that are forecasting as far out as 20 weeks out. And I think this has been problematic because the most sensational so-called forecasts that have been reported in the media have not really been forecasts. They've been speculations. And if you actually pay attention to whether the dire predictions happened or not, most of these speculations have been incredibly far off the mark. And again, it's like the situation's dire enough. We don't need to have forecasts that make it seem twice as bad as it already is. The CDC team has done something pretty interesting, which is not really fully baked yet, but they're moving toward creating a number of scenarios which are explicitly not forecasts per se, but are trying to basically cook up, what do different scenarios look like considered in a holistic fashion, just to satisfy people's need for having some kind of longer term idea of what might happen in a really kind of general way. And I think that's a very sensible approach. It's, when you start talking about scenarios, you're definitely not trying to tell people that you're, with great specificity what's going to happen. It really is just more kind of saying, well, could go this direction, could go that direction. And in software, I think this distinction between estimation and speculation applies very much. I've talked for many years about the distinction between estimate, target, and commitment. And an awful lot of times we have just pointless conversations, not pointless, but unproductive conversations where two people will be using the word estimate, but the project sponsor is really communicating a business target that they want the team to perform to, and the team is trying to communicate back analytical estimates of what they think it'll take, and it's really two ships passing in the night where they're talking about two different topics without realizing it. And we've had very positive effect on many organizations simply by clarifying the terminology around estimation, target setting, and commitment. And a lot of times an organization will say, "Oh, our estimation process is broken." We'll go in and look at that. We'll find the teams are creating fairly reasonable estimates, but what's really broken is the commitment process, and that is the team may come back with meaningful estimates, but the estimates say that they're not going to hit the business target. And so someone in the organization will just ignore the estimates and commit the team to the business target, and then everything unfolds in a very predictable way. There's too much schedule pressure. The team fails to meet its commitments. Everyone points fingers at each other. So cleaning up this terminology matters a lot in software, and I have a lot more hope about cleaning it up in software than I do in cleaning it up in the pandemic. I think news media is going to continue to present for speculations as forecasts, but in the software world, I think we can take ownership of our environments and be clear what we're talking about.
Well, that's good. I think that makes a lot of sense. So, as we step into that, there's a few factors I think we should touch on, and that's for the balance of this podcast. We're going to try and tie some of these, some of the guidance from your estimation book and the webinars and white papers and things that you've given over time, and touch on that and how some of the things you learned in COVID really connect with this. So, the first thing I mentioned a little bit was historical data. There's nothing better than having something to compare to as opposed to just having nothing to really reflect on or make a model about, right? That again is probably closer to speculation when you're trying to build something with no data to substantiate it.
Absolutely. In software, I think I've talked for a long time about if you can base your estimates on historical data, it just removes an incredible amount of speculation and judgment. And organizations are always trying to speculate about how much productivity is improving or how much faster the team is going to be able to move this release than they moved last release. And when you get away from the historical data with that sort of consideration, then you tend to insert error into the estimate. It's very difficult to avoid the wishful thinking that goes along with that. With COVID, I think the challenge has been more that we're just awash in historical data, but there are all kinds of data quality issues, and there's also just the question of which historical data to use. As I mentioned at the top of the podcast, COVID Complete uses pretty basic historical data, positive tests, total tests, deaths, and basically dates. But it tries to get really, really clear about what each of those bits of data mean. And the result of that is that I think the forecasts have been more accurate than average. And I think that sensitivity to historical data and sensitivity to does it mean what you think it means is very much a result of my experience working with software companies where we've had many occasions where we go in and a company thinks it has pretty good data and we start looking at it and we find that data does not mean what you think it means. The teams are redefining their story points for sprints and their story point inflation, or the teams are giving themselves partial credit for completing stories, and so they are effectively estimating how much progress they're making instead of measuring it. Those are two different things. Time accounting data gets messed up because people are allocated across multiple projects and they're not keeping track of how much time each person spends where. So data quality issues are just endemic to software development, and it's been a pretty natural transition to see how those issues pop up in the COVID context.
For sure. Well, I mean, I think about these models, and I think about these epidemiologists who've been doing forecasting for all sorts of things for a long time, and they've had models. Clearly, they had a head start on you, right? So, problems with those models, maybe they used or extended them. I mean, you made an example earlier in the discussion here about flu forecasting models. They used them and tried to extend them to this particular model as opposed to just starting with the data. That's an issue, right?
Yeah, that was one of the things that surprised me when I started participating in these weekly calls was that there was some discussion from the teams that were from well-established institutions that had been doing flu forecasting for a long time with these really mature models. And it actually makes sense in hindsight, but it was a surprise when I first heard it that they actually had to spend a considerable amount of time backing out assumptions about how the flu works that didn't apply to COVID-19. And so you would think that they would have a head start because of having the models, but I think in reality, the existing models didn't give them a head start. It was more of a handicap. And in software, we have this rule of thumb that if you're going to revise a system, if you revise more than about 25% of it, it's usually easier to just start from scratch and rewrite it. And I think from what I've been hearing, it seems like a similar rule applies to these very elaborate, very mature forecasting models. So in my case, what I thought was a disadvantage of starting from nothing, actually, I think turned out to be kind of an advantage. And if you look at which modeling teams have been performing the best over the course of the pandemic, you can make a pretty good argument that most of the better forecast models have not come from the established institutions, but have in fact come from new players like me who have built their model specifically for this particular purpose.
Yeah, I think that's really good. That's a great answer. I mean, kind of connected to that, and you've kind of already mentioned a little bit about this, is that a lot of these models are pretty sophisticated, but people tinker with them, right? So the idea of trying to keep the control knobs to a minimum on the models you build, there have to be comparative examples of that you saw as a result of your discussions, right?
I think so. When I use the phrase control knobs, what I'm really referring to is adjustment factors. And in the software world, we have fairly elaborate estimation models that have many, many adjustment factors. But I have become convinced that our psychology on the adjustment factors is that we think that we can take a base estimate, ideally one that we created using historical data, and then if we kind of tweak each of the adjustment knobs a little bit, we will tweak it to become more and more accurate. But what really happens with these adjustment knobs is that as we tweak them, we insert our own subjectivity and bias, and we move further and further away from the historical data. And we tend to exaggerate the effect of the factors that we are adjusting for, or in fact, they may already be accounted for in the historical data, and they usually are. So in the COVID context, like one question has come up recently, and lots of people have asked me is, what adjustment is the model making for these new, more highly contagious variants? And the answer is nothing, because my model is based on historical data. Highly contagious variants or any shift in that will be handled automatically through the way the historical data behaves. And if more people start becoming infected, we'll see more positive tests. If the death rate changes, that'll show up in the historical death rate. I don't need to make any adjustment, but for the teams that are not using historical data so directly, they are actually adjusting the control knobs on their models and trying to make changes for, then they end up making a raft of assumptions. How much more contagious is the new variant? How prevalent is it now in the US? How rapidly will it spread? What regions will it spread to? And you just have an enormous number of assumptions, and every single one of those assumptions is an opportunity for the forecaster's bias to slip into the forecast and I think make it less accurate. So I've learned this in software the hard way a long, long time ago, which is that if you are adjusting something on the basis that you originally estimated on the basis of historical data, very much more likely than not, you're inserting error into the forecast. And yeah, there's always going to be error in your estimate, but the adjustment is probably going to make it worse, not better. And so what we really want to do is find something that we can count reliably or measure reliably. And that's actually a significant part of the challenge. Is if we get that measurement to be truly accurate, then that can form the foundation of an accurate estimate. But if that foundation is shaky because we don't really understand the data, then things start to fall apart. So, like velocity in Scrum is a good example where if a team is pretty rigorous about measuring its velocity and it's not essentially fudging the velocity as time goes by redefining how many story points a story was worth, or saying, okay, well, so-and-so is on vacation, so we'll adjust velocity for that. Or, this thing turned out to be hard and we had to spend a bunch of time, rebuilding our servers. So we'll, artificially inflate our velocity for that. All of those tend to insert inaccuracy into the estimate. So we really just want to take the historical data as it is, and basically not mess around with it, and let it be the guide about. Basically, the past is the guide to the future, and as long as we clearly understand the past, then it can be a good guide.
That sounds great. That's good. I think that's great guidance. Another concept you have, we certainly have written about a lot, and our learning programs here at Construx touch on this quite a bit, is this idea of accuracy first, precision second. So tell us a little bit about that, what you saw from the forecasters doing the models for this, and we can kind of connect that to the software estimation space too, because we've seen that obviously.
People often confuse accuracy and precision, and treat them almost as though they're the same concept, but they're really not. If I say that it's 35.42 degrees outside, that's a highly precise number. But if it's really 70 degrees outside, it's not accurate at all. It would have been more accurate to say it's about 70 degrees outside than to say that it's 35.42 degrees outside. And this is a common confusion, I think, in lots of places, but I've certainly seen it in COVID forecasting. The teams are providing in their forecasts point forecasts, which is just the most likely number, but we're also providing prediction intervals, or you often hear these described as confidence intervals, which is not actually correct, but you get the gist of it when you say a 95% prediction interval. And really, your 95% prediction intervals should be capturing about 95% of the actuals. So, and because we've got this enormous data set of forecasts and actuals at this point, I've gone back and spent a fair amount of time looking at how the teams have done, and my own model included, and the teams in general are not capturing anywhere close to 95%. We've got on the order of half the teams that are capturing consistently less than 70%, with the ranges that are supposed to capture 95%. And we have several teams that are capturing less than 50%. And so basically, and if you looked at the ranges that some of the teams are using, they're just tiny. There's no plausible way that with ranges as narrow as they're using that they could get anywhere close to a 95% capture rate. The idea of the cone of uncertainty in software is that there's variability, and we want to accurately reflect whatever variability is in a release or a project at any particular point in time. And the less we know about what we're going to be doing, the wider the cone has to be to capture the possible outcomes. And I think with COVID, we basically have very much seen some of the modeling teams confusing accuracy and precision, where their point forecast might be pretty good, but then the error bars they put around that with their 95% prediction intervals are kind of a joke in terms of how narrow they are. And so what we really want to do is we want to get accuracy first. So the first thing the teams need to do is get consistently about 95% capture rate on those 95% prediction intervals. Once you get to that on a consistent basis, then you can start worrying about precision and narrowing down how narrow the ranges are, while ensuring that you're not losing accuracy as you tighten up the precision. But in general, I think precision first, accuracy second doesn't work, and yet that's the approach that we see teams take in software as well as in COVID. It's got to be accuracy first, precision second, and a big part of why it doesn't work is I think that to get to good accuracy in an environment where there's a lot of uncertainty is you have to understand uncertainty. You have to understand how much uncertainty there is, and I think an excess focus or premature focus on precision kind of blinds people to acknowledging how much uncertainty they're dealing with, and gets in the way of getting the accuracy dialed in. And so we really want to learn how to account for the uncertainty. That gives us a path to accuracy, and then we can set up a feedback loop where we tighten that up, and then we can get precision. And same exact progression works in software too, where if we're pretending that there's not a lot of uncertainty in our project, and we keep throwing out point estimates, we are typically going to miss those quite often. I mean, maybe always. We've seen organizations that never meet their estimates.
Right. Well, you touched on a little bit this notion of data variability in your response, and with the fact that the data are being produced by so many entities in the United States. Let's just take that as an example. You have the states that are bringing stuff in. You have a national forecast. Even if you're talking about different countries, there's going to be fluctuation in the data, right? So, can you talk a little about the data variability that you saw with the COVID?
Yeah, this gets pretty specific to COVID, but I do think it ties to some software analogies. We've got, basically in the US, we've got all the states plus District of Columbia plus the territories reporting data, and they vary significantly in how often they report. There are many states that don't report on Sundays, for example. And so if you're trying to look at daily data, but there's a big gap on Sundays, that's something you need to account for. There are some states that don't report on like Saturdays or Sundays, but not all the states. There are some states that just report on an extremely irregular basis. Like Wyoming, for example, reports less than once a week. And so, this gets to be fairly challenging in terms of forecasting what's going on when you have no idea when the reports are coming in. And some states, the bigger states tend to be a little bit more consistent. The smaller states tend to be less consistent. So we've got a weekly pattern that's either more or less consistent in various states. Holidays have been an issue where you just don't get death reports on 3-day weekends.
Nobody dies on holidays, right?
Yeah, that's right. We should just make it 365 holidays a year, and we'd be
right.
in the pandemic right now.
There you go.
And so we've got holidays as an issue. And then the other thing that's happened is just data corrections. States have come in after the fact and just dumped in large corrections that are enough to undermine the data analysis significantly. Last week, Indiana dumped in about 1,500 deaths on one day. And to put that in perspective, they're averaging about 40 a day. So 1,500 in one day. It was a multi-month correction going back into the September or something like that. And so then you got to say, well, what do we do with this? They're saying that these people died, and so they should be accounted for in terms of the modeling somehow, but they shouldn't all be accounted for on one day. So we need to figure out what to do about that. And so the analogy to software is extremely straightforward here, which is, if you are tracking your progress in really big chunks, you've got an epic that you have not broken down, and you're going to give yourself full credit for the epic when your team is done. You could work for a couple months with no progress according to the story point progress, and then you complete the epic, and boom, you've got 50 points or 100 points all at once. And we really would like to break down epics into stories, and ideally into fairly small stories, so that we can track progress meaningfully on at least a weekly basis, or maybe closer to a daily basis, as teams just check off the work and drive the work to completion and get credit for the story points on a more atomic basis. And I think the data quality issues in software are very analogous to what I've seen in the COVID space, where if teams are not accounting for weekends or holidays, vacations, sick days, then you can really undermine your planning by not accounting for these things that we know are going to happen. And I think of this very much in Deming's terms of common cause variation and special cause variation. There is variability that we have to account for, but a lot of it is common cause. It's predictable, and we've seen it before, and we can account for it. And if we do a good job of accounting for all the common cause variation, it actually gives us more bandwidth to correct for or to respond to the special cause variation, which we really can't anticipate in advance. But if we're already overwhelmed because we're not doing a good job of dealing with common cause variation, it really diminishes our ability to deal with the special cause variation.
Yeah, I think that makes sense. And, having teams account for velocity changes because if somebody is taking vacation, somebody is out for a few days being sick. I guess that falls into the category of common cause. You're aware of those things. But if all of a sudden it becomes a sunny day and half your staff goes and plays golf, that might be a special case.
Right. Your team wins the Super Bowl or whatever.
Exactly. So we have a couple more areas I think I want to touch on. This gets back to a similar place. which I maybe call truthiness. If you know, I know you're a big Colbert fan, so that kind of sits with you well. The first thing that I think about is about keeping your eye on the truth is the idea of minimizing the difference between what's been reported and actual ground truth, right? What's reported and what's actually there. So let's unpack that for everybody. You saw that in the COVID work. How does that relate back to software?
Right. So I think we probably covered that adequately in terms of the COVID issues. There is a gap between what's really happening and what gets reported. And Thanksgiving, I think, was kind of the worst, where we had a 4-day weekend where, like you said, there's the number of deaths reported over that 4-day period, which is a pretty long period to go without reporting in this context. And it kind of affects things on both ends. It makes it look like there's a dip where there isn't one. But then as you backfill the data, it looks like there's a surge where there isn't one. And so like in the reporting that happened immediately after Thanksgiving, very predictably, we had news stories about the highest death days ever. And it wasn't really true. They weren't the highest death days ever. It was just the highest number reported on those days because we were backfilling for data that didn't get reported over the Thanksgiving weekend. And I knew that was going to happen. I just was bracing myself for the cringeworthy
immediate output.
Right. Of the data after Thanksgiving. In software, I think teams just need to be really careful to try to minimize any kind of gap between what they're reporting and what represents the ground truth of their project. So, if you are really diligent about having a definition of done, driving your stories to a state of completion, giving yourself full credit only when the story has been completed, this is a pretty minimal gap between ground truth and what's being reported. But if you don't have a clear definition of done and you're declaring things to be done and giving yourself credit, and then you find yourself having to go back and do rework on those things because they weren't really done, well, now you've given yourself credit that you didn't completely deserve because you weren't actually done, and we're opening up a gap between the ground truth and the reporting. Teams sometimes will give themselves partial credit for work that didn't get completed during a sprint, but they think they're going to complete it the next sprint. Well, now we're not really talking about ground truth. Now we're talking about your estimate of what you got done, or your estimate of what percentage you got done during the sprint. So we open up a little bit more of a gap between the reporting and the ground truth. Certainly, if we find ourselves changing the point values of stories after we completed them, we say, oh yeah, we gave this 3, but now that we've done the work, we think it was a 5. That also, I think, inserts error into our velocity because in the future, we're not always going to know 100% that things that we say are a 3 are going to turn out to be a 5. So when we change that point value, we're essentially saying we're going to become better at assigning points in the future than we have been in the past. And I think that's not a high likelihood assumption. So we just need to be really diligent about making sure that we're keeping the numbers that we're generating and the reporting that we're doing on those numbers, and certainly any kind of estimation based on those numbers, as close to the real truth of what's actually happening as possible, and that we don't allow our subjective judgment to creep in.
Perfect answer. And that kind of segues into the last topic I thought we'd hit on, which is really kind of one of my personal favorites of all the things that we talk about today, and that's this idea of simply closing the loop. And I think you have remarked about that repeatedly in the work with COVID. Is like, my God, man, you have the data. You have your estimate. How are you doing? How come you're not looking at that as a way to kind of keep yourself honest, right? And that's another area just blew you away when you started sitting on these calls, right?
Yeah, I don't want to beat up this issue too much, but you're absolutely
I'm
right.
allowed to.
I literally just didn't know how to react when I started recognizing these teams literally just didn't care. And for some of the teams, I'm convinced it was just an academic exercise where it's like, hey, we get a chance to learn about machine learning, or hey, we get a chance to learn about artificial intelligence. It's like, okay, fine, but it'd be nice if we actually all could learn about it when we're all able to sit in the same room and see each other face to face. And by the way, if we can have accurate forecasts, that will help. It will help plan medical responses and government responses, and make sure resources get to the right places at the right times. And a team that's sitting there saying, hey, I learned something cool about machine language, but my forecasts are all off by 200%. Is not helping anywhere near as much as they could. So I started doing various charts and graphs and spreadsheets and so on that help the teams be able to easily see how they're doing. And I think this notion of just close the loop is a fundamental notion. I mean, the name of this podcast series, Inspect and Adapt, is in essence saying close the loop. It's we have to be inspecting how is the thing we're doing working, and then being clear-eyed about it. If it's working well, good, we'll keep doing it. If it seems like it could be working better, then we adapt. And so that really needs to be applied to forecasting. It needs to be applied to software estimation as well. And the nice thing about Inspect and Adapt is it almost doesn't matter where you start. If you do it diligently, rigorously, you're going to improve, and eventually you'll improve to something that's pretty good. I think that we are in fact seeing that. I was doing some analysis earlier over the weekend that was looking at whether the teams had actually been improving their forecasts over time, and in particular whether my model had improved its accuracy over time. And I was quite pleased to see that in fact the accuracy has improved over time. And it's interesting, what would have been a number one forecast out of a set of forecasts back in September, October timeframe, right now it's more like middle of the pack forecast in terms of accuracy, because all the teams have been improving. And so that's gratifying to see. And of course, I'd love to see that in software as well. And that's what we've spent, quite a few years now helping teams with, is getting them to the point where success is commonplace, accurate estimates are commonplace. None of this is really rocket science. A lot of it's just kind of general purpose math, but you need to learn how to apply it to your specific software context. And, as we've worked with lots of companies where they have been able to get to the point where the vast majority of their releases are delivered on time with predictability and without burning out the team to get there. And one of the things I've liked about the COVID experience is just, I have seen all these forecasting techniques work well in software when people use them. I'm not terribly surprised that they work pretty well for COVID forecasting. Just because of the magnitude of the data set and the ability to analyze actuals versus forecasts, I think I've had some interesting insights that from the COVID forecasting that can be applied right back to software estimation. And some of it's just reinforcing lessons we've already learned, like using historical data. But the big one is the one we're talking about right now, closing the loop. It's just such an important topic. And if people take away one thing from this conversation, I think that should be it. It's just make sure that you're paying attention to how your estimates did, and learn from them.
Well, it sounds like you created a rising tide there, Steve, with a lot of your work there. It's nice to see that, teams are receptive to your messaging about trying to do that comparison and trying to make their models better. And, I think we've seen that with all the teams we've worked with over the years from a software engineering perspective. If you do have the discipline to apply these things and keep tracking and closing the loop, then you are going to get better at what you do.
It's been interesting. I look at the weekly results of the forecast now, and the thing that the teams at the top of the list have in common is that we're all talking. And
that's great.
The thing that the teams at the bottom have in common is we haven't heard anything from them. And so that collaborative aspect of teams sharing what's working and so on, I think has been really helpful. And, in software, we've helped companies establish communities of practice, and I think it produces the same benefit there.
Most definitely. Inspect and adapt. We couldn't pick a better place to round out today's podcast with that phrase. Steve, terrific conversation. Solid advice once again, as always. We appreciate you taking the time and sending some cycles with us for this.
Well, it doesn't take much to get me talking on the topic of estimation. You press the on button and we're off for quite a while.
Absolutely. By the way, I just should mention here, there is a recorded webinar that Steve did related to this podcast that goes into the gory details behind the COVID complete forecasting model. I would say danger. There is math involved, but it's not too bad. So I think you should be able to handle it. You can find that link in the podcast description if you didn't see it when you came in already, but it's all great stuff. So with that, we bid adieu. Be sure to tune in again for another episode of Inspect and Adapt, the Construx podcast. Until then, this has been Mark Griffin as your host. Liz Ostaszewski has been our audio engineer, and Devin Musgrave is our producer. If you enjoyed this episode, feel free to give us a positive rating on Apple Podcasts, Spotify, Stitcher, Google Podcasts, or wherever you would normally find us. If you have comments about this or like to talk to one of our practitioners, or you have ideas for a future podcast, reach out to us via email on comments@construx.com. Again, that's comments@construx.com. We'd love to hear from you. Keep staying safe, everyone out there, and have a great next sprint.